All right, everybody, if we could have you take your seats again here. The hot box is about to begin. Make your way back to your tables, please. Quick reminder, if you haven't picked up your free tickets for the packed dinner tonight, now's the time to do it, or at least after the hot box out front. Minimum donation suggested, but it gives you priority seating to the gubernatorial forum. And we'll want you back here about 6:15 to get seated for that, which will begin shortly after 6:30 tonight. As you make your way back to your seats, please, I'd like to introduce the CEO and President of the Greater North Dakota Chamber, Andy Peterson, to introduce our panelists. Andy.
All right. Welcome to the Hot Box. This is absolutely an experiment, but I think one that's going to be a lot of fun. So, gentlemen, you've asked me a lot of tough questions over the years. No, it won't be bad.
Payback.
Now it's my turn to ask a few questions. So you guys are going to be the panelists, but we're going to have people that are going to be interrupting you, either agreeing or disagreeing or adding or taking away from your conversation. And here's how it works. So I have this little clicker in my hand, and it will be situated at the hot box on either side of the stage. And if you press the Y button, you'll see it right here. It's supposed to work. There it is. You see that? Okay, so on that hot box, that person over there wants to agree with something on the stage and add some commentary. Now, the back will reset it, and if you disagree with what's happening on the stage, there you go. So now you're going to interject, and you're going to stop, and you're going to disagree with what's happening on the stage and disagree with what's happening with one of these folks up here. So, guys, good day so far?
Great day. Good job.
All right. Thank you, Scott. It's been great to have you. Chris and Joel, thank you. You guys are returnees. Scott, you're a little bit new with us up here, but you fit right in. So thank you very much.
That means you're first.
That means you are first, maybe. Well, our first topic, we're going to talk about immigration reform. And by the way, a lot of these topics may or may not come up at the legislature. We always keep our ear to the ground. We're always interested in what may possibly be talked about. And immigration reform. Scott, immigration reform, your opinion?
My opinion is we have a mess, a big mess in this country that needs fixing. There's no doubt about it. I think that if you just are reasonable about this and don't look at a particular constituency, I mean, I happen to think the U.S. Chamber is a little too zealous, and hey, this is a workforce problem, right? And the folks that want to load every illegal immigrant on a bus and send them home are nuts too, right? So there's a middle ground there, but clearly we have a problem. I mean, we don't have a border that's secure. We have a porous border, and we have a 911 like problem with ISIS and knowing who people are. So for those two reasons, we need to get our arms around it. Build a wall, baby.
Build a wall. You like Mr. Trump building a wall?
No.
All right, Joel, let him talk.
I mean, Donald Trump's an idiot. Donald Trump
I told you to be hot.
Is not going to be president of the United States. The Republican Party doesn't like Donald Trump. The people with brains in the Republican Party don't like Donald Trump. They know that he's not going to end up being president of the United States, and now they're just trying to figure out how to salvage their party from Donald Trump. Here's the problem.
Okay.
If you want to solve immigration, you can solve it in one swift stroke. Anyone in the world that hires an illegal immigrant, throw in federal prison for a year.
Wow, all right.
You know what they're going to do?
What are they going to do?
Spoken like a true Democrat. Punish the businesses, the
Well,
employers.
why are they here? They're here for jobs.
Sure.
They're here for jobs, and they're here for cheap, free labor. There were a bunch of illegal immigrants down in Oaks, North Dakota. Remember that? It isn't just all over the country. They were in Oaks, North Dakota. The Potato Boys wanted workers, and they wanted them cheap. They had them sleeping in a warehouse. Do you remember that?
It's Tom Campbell's fault. Potato farmers.
Think about that. Think about that. What price did they pay? They said, oh, we just subcontracted these guys out of Oregon. Okay. If that's true, then go to Oregon, find the guy that hired these guys, throw his butt in jail.
Some of the biggest people here illegally are also people that are here over their extended visas. We have no way to track who's here on a visa, and if you do your homework on this, you look, there's an international study about people from India. Who's the #1 country we're hiring visa people from is from India. They scored number 74 out of 74 on their math test. We've been sold a bill of goods that we can't do STEM, we can't do science, and we can, and now we're diverting our young kids, not going into those industries so that big corporations can get cheap India people.
So
to
what
work
are we
for them.
afraid of from them? Let's
From who?
just assume.
Nothing. I love
The
America.
11 million people that you quoted. The 11
Well,
million people that you
ask-
quoted.
ask-
What
ask-
about them scares you?
Well,
Nothing.
ask the family members that have loved ones that are now dead and buried at the hands of illegal immigrants who come here. And by the way,
So name them.
a fan
Name
wants,
the illegal immigrants that attacked us. Name them.
there's the one in San Francisco, the woman
Name the
there that-
illegal immigrants. We got attacked by a bunch of Saudis that we do business with on a daily basis. Come on in, you Saudis. Come on in. 9/11
you
was
said
a
Donald
bunch of
Trump
Saudis.
is not going to win. We've got a presidential candidate named Hillary Clinton that says she can vet an increase of 550% of refugees. She can't even vet the VIPs at her own rally. She had Omar Mateen's dad sitting there in the VIP section with a big red hat on.
So let me
So
ask
you're-
this question. So if you had a border that worked and people could come in and work and find work as they needed it and then go home when that work was done so that it was porous but it was properly vetted, what do you think?
We need to know you are who you say you are.
Right.
You need to be there. I think that's one option. I wouldn't be for that option until we get our arms around the situation. And
But Scott, how do you do that?
Well,
How do you do that today?
look. I can't go buy a bag of chips with a credit card without swiping it, and they instantly know whether I've got the $1.50 in my account or not.
Sure.
So there's a part of me that's with Joel to say, wait, there's a way to figure this out, to say, are they here legally or are they not? Can they work for us? And of course, then you start talking voter ID, and these guys freak out if you give anybody a card, and they are who they say
Let's
they
not
are.
talk about voter ID yet, but could you?
But it's tied to the same thing, because as
Sure.
soon as you start saying you've got to have a card, oh,
So some
you're coming for
mechanism,
us.
some
Right,
mechanism.
Exactly.
All right, could you give more resources to law enforcement? Because if you do that, you're going to need more resources to do the courts, the whole thing, and whatever.
We're funding law enforcement just fine in a lot of cities and states and sanctuary areas. But the fact is the matter that we have a Senate right now that won't pass a bill that will stop funding to federal sanctuary cities. We had a situation in San Francisco where Kate Steinle was shot by an illegal immigrant who was deported 5 times, convicted 7 felonies, and he's walking around with a gun.
So here's my point, and it's crystal clear. We're not talking about a person in San Francisco. We're talking about millions of people. And the one thing that you got to concede is there's an acknowledgement amongst conservatives and progressives up here that we have illegal immigrants, right? Why? Why do we have them? You know why? Because they're doing jobs nobody else wants to do. How many times have you been to a big city, walked into the hallway in the morning to go to your meeting and tried to converse with the lady that's cleaning your room?
But that's no argument.
She doesn't speak English.
Joel, that's no reason to let people come here illegally. I mean, that you don't say, well, we need who's going to
I'm
do the
going
jobs?
back to my original point, Scott.
Got to clean your
The
room.
person that hires the illegal alien, make that punishment. And I'll tell you what they'll quit doing. They'll quit hiring. But you guys, you sit here and talk about voter ID. You guys are so
How about
afraid
we
to
do
actually
this?
pay somebody a decent wage to clean that
Oh my
damn
gosh,
place.
Don't
because
give me that.
now you're going to define a decent
Exactly.
wage. Here
That's
we
why
go.
if you go
All right,
on
you
your
want it.
homework
You
right
want
now-
it cheap. You can get it cheap if they're illegal. Hush, hush. Wink, wink. Nod, nod. We don't want that union worker to get paid.
And
We can get it
why-
for next to nothing.
why are
I
they
don't want
hiring
you
illegals?
deciding what a fair wage is.
Why
That's
are,
what I
they,
don't
why are they
want.
hiring illegals?
Well, you know what's deciding what a free wage is? If there's
The
any group,
marketplace.
if there's any group that should be against illegal immigration, it should be union workers. It should be the blue collar union workers.
are.
They're paying the price for it bigger than hell, and you know it.
So
and
why
you
are we
don't-
hiring illegals?
Because it's cheap.
Right. So my point is,
It's cheap,
let's
and
do
you're
this.
not punishing the people that are doing
Then
it.
you know what they have
that
to do
know
that?
that nobody's going to
Guess
work
what
for
nation
that.
has the highest corporate tax in the world? We've got over $2 trillion right now sitting outside of our borders. So we have a 35% corporate tax rate. Companies would love to repatriate that cash in here and say, you know what, I'd love to hire Americans, but I'm not going to bring it back in these borders if it's a 35% tax rate.
Is that in Bahama where they took their corporation,
my
or
gosh.
All right.
where was it?
That's my point.
Yeah.
Google went to Ireland.
Yeah.
There was a city, Medtronic, went out of Minnesota,
And
went
they're
to Ireland.
patriotic, and we better
My
stand up.
point is if we lower the corporate tax rate, we would repatriate the money, keep the money in the United States, and we could hire Americans at fair wages.
So, gentlemen, we all agree we need immigration. It's just how you get it done and how you get it done legally.
What
Fair?
What are
Absolutely.
you saying
I don't,
specifically?
Andy, I'm going to just say this, and these guys will be mad at me for saying it, and I can live with that. Illegal immigration isn't the problem it's made out to be. Donald Trump was talking to an idiotic audience. Now he's talking to a brighter, more educated audience, and that brighter, more educated audience isn't buying what he's selling. The Tea Party people that he was selling to in the primaries are no longer the people he needs in the fall. He just hopes they're still there for him in the fall. Illegal immigration is not as big of an issue as you think
You
it
just
is.
said the union workers should be against it.
Well, I'm just talking in
So you're
general
saying
about
the union
cheap
workers
labor.
are idiots.
But to go to your point,
I'm
Andy,
just talking about labor in general.
You just
Chris.
said Donald Trump was
I didn't
resonating.
call
'cause he was-
union
All right,
workers
so
idiots.
You just
Don't
said
put
that they were
words in my mouth.
idiots.
Joe, let's
People that
call that
listen
your
to
last
him.
word. Your last word in immigration, Chris.
We need to obviously shore up the borders. I've got no problem with legal immigration, but I'm sick and tired of watching American people that are getting paid not decent wages because we are pouring in 1 to 2 million immigrants a year to lower down wages.
It's absolutely a problem. It is certainly a problem when we need to worry about ISIS. By the way, Canada has the most lax immigration rules of anybody in North America for sure, and so there are ways to get in from the border there once they get in, semi-legally to Canada. So it's a problem we need to worry about on the security front. Legal immigration and reforming legal immigration is the answer.
Does the wall go up in Alaska too?
Let's talk. Let's move on. Let's move on. Let's talk about marijuana decriminalization. Now, I know we've got a HotBox expert on that who wants to jump up and talk about that. So when he presses the button, we will talk with him about it. So your opinion, Chris?
You're asking if it should be decriminalized?
Yes.
To what extent?
Well, again, you define
Completely
it.
legal, or obviously we've got a perfectly situation at home here that we could talk about to say that this thing should not be a class 1. I don't know if it's a felony or how you do that, but when you've got a young man at a state college that gets busted for selling $80 of marijuana and he gets threatened with 40 years in prison, what was it, $40,000 in fine, that is ridiculous.
Found dead in a river.
Thank you for finishing that story. And so there's got to be a way that you decriminalize it and find out a situation where we're not using students because of the situation that it's at when everybody knows he never would have got 40 years and $40,000 fine.
All right, Joel.
You want to see trouble?
Yeah.
Here it is. How many people here have smoked pot? There you go.
Very few hands have gone up.
I think some
see
of you
two
are
hands.
liars. I'm just saying. So you're going to put these people in prison? The truth of the matter is people smoke pot.
All right.
Okay, I work in radio. People smoke pot.
All right, well, I didn't raise my hand, and I was being honest. And
I've never smoked pot, but
Yeah.
I've sure been around it.
But my point is this, the guy over my left shoulder over there,
Yeah.
that's the opinion I care most about. A fellow by the name of Dan Donlan, who happens to be the chief of police of Bismarck. I don't think we give.
Yeah, but Mr. Donlan, this is not, I'm not gearing this towards
I
you.
didn't finish my statement there, Phil.
All right, well-
So all I'm saying is that I defer to law enforcement on this one. I've not seen anybody of any credibility whatsoever in law enforcement say, yep, you go for it. Just decriminalize it, get it away, take care of it, everything else. I also think we ought to criminalize what the BCI did to Andrew Sadek. I mean, I'm not suggesting that was a good thing. That
But
was
how do they break the law?
That was a
What are you
nightmare.
gonna
Well, I
do
don't think
against
that kind of activity of strong arming him to be a narc so they could find more people, that was ridiculous what they did.
All right,
I'm not trying to.
Chief Donlan.
Yeah, I think we need to be smarter on the sentencing and what we do in response to that. It is absolutely an addiction issue. Mental health addiction, a lot of it ties together. We need to be smarter on simple possessions. Whether to legalize it, I don't agree it should be legalized. It's like playing Russian roulette. Are you going to become addicted to it or not? And I've talked to some individuals, and the more you use marijuana, you're going to get about 75% that are going to go on to harder drugs. They're going to be around a group of people that are going to be experimenting or doing harder drugs, and that addiction sets in, and that really is going to, we're hoping these are going to be productive employees in businesses, but if you're legalizing it and you got some buzz driving issues going on, or they're showing up for work or not showing up for work.
All right, stay right there. Representative Becker.
No, your mic in there.
So can I ask a question to Mr. Dahlman for a second? If you watch the 60 Minutes piece about Andrew Sadek, can I do this real quick, Andy?
Yep.
One of the challenges that came up with the situation where you're criminalizing marijuana is obviously these people are getting a ton of money for their police budgets via the DEA. So is it a good idea, because I'm a big believer, for you out there that have salespeople, compensation drives behavior, is it a good idea to unhitch funding based on drug arrests?
We have very little to do with the federal seizures, asset seizure and forfeitures. We do local asset seizure and forfeitures, very little on the federal level. The criminal behavior, the point in that isn't that we want to give the government or the police the more money. The point is we want to hit them where it's going to hurt them a little bit. And arresting them third, fourth, fifth time offenses before they ever see any serious time in jail isn't going to quite do it. They're getting a lot of breaks in the first place, but if they lose their car when they're in the process of dealing or selling and things like that, the intent is just to hit them a little bit harder.
All right.
All right, so one thing that's important to clarify, it's not yet been clarified for this audience, decriminalization versus legalization, two very different things. And I spoke about being in favor of decriminalization during the gubernatorial debates, and I got slammed because people misunderstand what it means. It first came to my attention with Andrew Sadek. There's no way a kid who had 80 over the course of 2 occurrences, had $80 worth of pot should have been looking at the possibility of 40 years in prison. That's ridiculous. Secondly, we've got overcrowding in the jails and prisons, and we've got a problem with spending, with revenue, with our budget. So it occurs to me that there's an easy solution here. Now, the voters are going to have a choice in what to do with legalization for first medicinal and then recreational. Whatever North Dakota citizens want to do, I don't care, that's fine. They're going to vote how they want to vote. But decriminalization addresses these other questions. We've got, instead of focusing on mental health, we've been focusing on incarceration or using it as a coercive means to get people to go into confidential informant programs. What decriminalization would do is to say, this is still against the law, but it is now an infraction. Okay, infraction can carry a penalty of up to $1,500 in North Dakota. That's still a significant penalty. It's still illegal. Second time you get caught within 1 year, it becomes a Class B misdemeanor. Now you can start serving jail time, but at least it's much more reasonable. I believe DOCR told me 34% of the people in prison are there based on alcohol and drug-related things. They're not being helped the way they should. There are other ways we should do it. Throwing them in jail is not the thing. We're actually separating. Like Joel was pointing out, I'm going to suspect that most everyone here knows of somebody who has smoked pot. Okay, do all of these people belong in jail? That's a question we have to ask ourselves. Decriminalize it, address it. It's for the voters to decide if they want to legalize it, but we can address these other problems by simply taking it down from a misdemeanor or felony down to an infraction.
Thank you.
If I
It's
can just
also
speak
a
to
pretty
that.
worldly community, too. With all due respect, you people travel. You do it for your professional life and your business. I went to the state of Washington for the bison last year. We had the bison contract. On a break, I go outside, and this absolutely tall, gorgeous, very professionally business-dressed woman walks outside, and I thought, man, she smokes. You know, it ain't often you see that anymore. People have kind of quit tobacco. She lit up a joint.
Oh,
She went back to work. Exactly what the doctor was getting at.
Well,
Does she belong in prison?
No, there's something to shoot for, huh? Boy, you know, have our people leaving the workplace and lighting up. That's not what I want.
No,
I mean, I don't want another Colorado.
My point is, it's legal, and what you're finding in states like Washington and Colorado is...
Colorado's a nightmare, Joel. It's an absolute nightmare. People are flooding in there to buy this stuff on street corners. You ask people that were in favor of it, they hate it now.
Well, tell them to vote again. Tell them to vote again. See what happens. And what do you think's going to happen, Scott?
Well, I'd love to see it.
I would
you
too.
know, yeah.
Because I think you're wrong. I think you're going to find out you're wrong. I'm not for legalization as much as what I believe in what the doctor said. That what we're doing is...
You heard it here
I
first.
used to go out on Wednesdays to the pen when I was in the session. We used to go out and play racquetball at the pen. And I remember the warden, I forget his name, but I asked him, how many people in this place physically need to be in this place? They're a threat to society. He said less than half. We're paying them. We're paying for
Well,
them.
that's
Put them
sentencing
on the
reform, though.
workforce.
That's not letting people leave the workplace and light up and then go back to the workplace. We're talking about two different things.
That's your job as an
I want to know
employer.
what your solution is, because if you look at the war on drugs, we're spending, what, $51 billion a year, and that's clearly not working. We're losing people left and right due to the opioid crisis and whatnot.
Yeah, my answer would be to Joel's question for the warden is find the ones that belong there and find the ones that don't, and deal with that issue rather than say, Katie, bar the door, let them go, whatever they want to do.
Scott, this started with 3 strikes and you're out.
all right.
This whole debate started with 3 strikes and you're out. I'm going to get tough on crime, 3 strikes and you're out.
Yeah,
Our prisons exploded and you know it.
Mandatory sentencing needs reform. There's no doubt about it. We're all
right.
on the same page there.
All right, good. So a couple of agreements, Hannon and Heitkamp right there, and Heitkamp and Becker.
We both like hot spring spas too.
All right, there you go. Chief Donlin, you've been waiting over there?
No, I was just going to add to what Representative Becker was talking about is if that's the route that it goes, I don't think that's a bad idea, but we got to make sure that we are funding and increasing our capacity in the area of mental health and treatment. Legalizing isn't going to help any of that stuff whatsoever. People will still become addicted, not everybody. Some might be able to function, majority, maybe not. But we've got to increase that capacity for effective and efficient treatment in the state of North Dakota. And we're behind the 8 ball, and we all need to work collaboratively together to make that happen.
Thank you. Last words on this?
Andy, did you hear me say that I'm in favor of legalization, just for the record? No.
No,
just
I
keep
did
in
not.
mind.
I heard decriminalization.
That's right, and the arguments get convoluted. Decriminalization, I believe, when people understand it, is where the vast majority of North Dakotans will agree. Some think pot should be legal, some think it shouldn't. The vast majority think that we need to do something about our prison system, and they do think that what happened with Andrew Sadek is wrong.
Thank you. All right, last words. Chris, you even had a last word.
Well, I just want to share, I would encourage everybody out here to go read. There was a great piece in the Wall Street Journal about where now we've legalized marijuana. I've mentioned this a couple times today, but I think it speaks volumes about this. You know, what's the solution here? Because the cartel they're business people. They don't care about anything else but their profits. And when you see that because we've legalized marijuana, and I'm with Representative Becker, we need to decriminalize it so we're not having an Andrew Sadek situation. At the same point in time, I don't want the cartels flooding our borders with heroin at a cheap expense that is obviously much more addictive than marijuana.
All right. Have we solved it?
Ask the audience.
By the time we're dead and buried, pot will be legal.
All right. You heard it here.
But is that, all right, I'll leave it let it go.
No, it will be. I mean, there's a generation of people that came up, and this happens because my mom never grew up around pot, right?
Sure.
But my sisters who went to UND probably smoked pot.
Ladies and gentlemen, that'll be in the newspaper tomorrow, right there.
I said sisters.
Senator Heidi Heitkamp smoked pot in college.
These Republicans are good at putting words in your mouth, aren't they? But I will tell you this. If you're going through a dreaded, terrible cancer treatment and you want a joint, I sure would get you one.
But I think medical marijuana and recreational are two different conversations.
things.
Yeah.
Right. I mean, there's research now that shows Medicare expenses are down 165% where states have legalized medical marijuana. I think, okay, and at
Vote
the
in
same point in
Colorado
time,
again.
well, but also there's Minnesota and other areas where it's legal. And at the same point in time, what they're seeing is there's not as many people on opioids, so they're not having the addiction to opioids, then going to heroin because they can't afford that, where now obviously they've got legalized medical marijuana, and they're solving some of those issues there.
All right, so let me lay the groundwork for the next topic. And I remember when the pharmacy issue went on, we said, listen, we need to open up the pharmacy market to free enterprise. We lost that battle, by the way. A couple of representatives from small towns said to me, Andy, you are going to kill North Dakota and its character if you get rid of pharmacies in small towns. I think that might have been a bit of an overstretch. I think the highway system and mail order pharmaceuticals and all these kinds of things have kind of changed a lot of that. Might be a bit of a stretch, but there is a new issue out there right now where we're talking about getting natural gas to small communities. And let's take Rugby, North Dakota. I visited with Rugby Manufacturing, and they said, listen, we have two issues. One is that we get natural gas into our factory because it's vitally important to us. And number two, that we have a good, solid workforce. We can't expand in North Dakota beyond that. And so there's a couple models out there about getting natural gas to some of these small towns. One is kind of a rate-based thing where you spread it out amongst many people. Another one is just letting Rugby pay for it themselves, or Rugby Manufacturing to pay for it themselves. And some of the propane dealers are a little skittish about this. So what do we do about this? How are we going to proceed to make sure that rural North Dakota, as well as the metro areas in North Dakota, succeed and all have natural gas and propane and things that they need?
Why do they have rural water? I managed a rural water system that covered 7 counties and had over 30 communities as members. Why? The federal government subsidized it. We took out loans locally. We built the infrastructure. We did it.
Sure.
We saw the need. The water quality sucked, and we brought water, good treated drinking water in. Same thing can happen with natural gas, but you got to be willing to make the investment. If you think it's going to be, why is FedEx in Fargo? Tony Gehrig nailed it.
Yeah.
It wasn't for a tax break. Tony was spot on right. They're in Fargo because it's at the intersection of 2 great big interstates, right? They were coming to Fargo whether they got that tax break or not. If you put natural gas in these communities, you will see these communities flourish. The same way if you put sewer, curb, gutter, everything else in it. And you as a state are all going to be against what I'm about to say, but you have the ability by simply saying you're not getting another permit by burning off the natural gas. We'll give you a permit, but show me your plan within 6 months to a year where that thing is capped and the natural gas is going to use.
What in the world here? You've confused
Called the
me.
regulation.
You confused me. So you're saying that we should go to Watford City and find a flare and say, okay, who's the company? And because that's a flare, now mind you, nobody likes flares, right? Nobody says, oh good, we're flaring off natural gas. I mean, the idea is...
Actually, a lot of you like flares. You see it as success.
Well,
I heard
no.
you guys bragging about, my God, you can see us from the sky. That was energy getting burnt off.
Yeah, well, what it was a sign of success, Joel, that the gathering system, and when I got a $100 bill coming out of the ground in the form of oil, and I got a $1 bill coming out of the ground in the form of natural gas, I'm not going to show off the 100 to stop the one.
So what's
I don't
the
like
policy
losing
in
the one.
Texas and Oklahoma?
I don't like the one.
What's the policy in Texas and Oklahoma?
I actually don't know. And
You don't know.
I don't care.
I'll tell you what, they don't let them burn off the natural gas.
But it's a
That's 'cause they have the
different world.
infrastructure.
It's completely
If you
different.
tell
world.
them that they've got to manage the natural gas,
Gentlemen, we're off topic.
They're going to find
Yeah, we
a
are.
company to
We're
move
off
it.
topic.
Yeah.
This
Well,
is about getting natural gas to small
Well, but his
communities.
point is, let's
gotta go
let's
somewhere
put the
then,
thumb on the
Okay.
companies, is what he's saying, Andy, that says if you flare out here, which has nothing to do with the problem in Rugby, then you are not going to get you've got to fix that before you do that. That's what you're saying, right?
Where is the natural gas?
Well, I mean, the natural gas everywhere.
Where is
but
it?
My point
Where
is,
do you go to get water? You go to the Missouri River.
But the flaring problem has nothing to do with Rugby needing natural gas. I think the issue here, to answer your question, Andy, is that if I'm Bobcat in Gwinner and I don't have access to natural gas, that's a concern. That's a problem right now. And they only have the access to propane. Now, if I'm a propane dealer, I kind of like that. And I get that. A propane dealer is going to say, welcome to the free market. I've got to solve this. My understanding from people that are in this world is that problem is being addressed. There's different ways to do it. There might be gaps. When there's a gap, then you go Joel's route of, wait a minute, how do we do this alone here?
Are you really
Do the
going to tell me,
repairs?
you who hang out with Harold Hamm, who have him in your cell phone, are you really going to tell me you don't know what the natural gas policy of Oklahoma and Texas is?
No, I mean, I don't, but my point doesn't really matter. I mean, the
It
flaring...
does matter. It does matter.
No, it doesn't.
It's a perfect example of developing a resource that's being burnt into the sky that mineral owners of Western North Dakota are not being compensated for because we like Harold better than we like a guy farming outside Tioga. That's why it matters.
You guys are really good at stirring the pot with no facts behind it, and this one is a good one. I mean,
Harold would make a great energy secretary, Scott.
nobody-
He had an extra $1 billion to give away.
Well, Harold's in the oil business, right? So oil comes out of the ground. He's happy about the oil coming out of the ground. But my point is, should we even continue down this track? Because we're talking about flaring that really doesn't have anything to do with this topic. I'm happy to talk about it.
Yeah,
Chris, go ahead.
For the oil companies to help create the infrastructure. You talk about Texas and Oklahoma, the reason they're capturing this is because they've already got the infrastructure in place to do that. We don't have that. This is obviously a
No.
boom.
They were given a date. They were given a timeline. They had to capture it.
They're
They
doing
weren't
it.
allowed
The
to burn it off.
infrastructure is
Flaring's
already
down.
there.
Flaring's tracking down. By the way, one of the big problems with the flaring that does still exist is your beloved federal government that does not permit these pipelines fast enough on the gathering systems. They're trying to build
Is that
out
why
the
the
gathering
mayor,
systems.
the mayor of Williston, the head of the economic development in Williston, and others said, at the height of all this, slow the permitting down.
Joel, that's ancient history. That's ancient history at a different time.
Because you didn't live
Nobody's
there.
saying slow it down now.
They had people
They're saying
sleeping
bring it
in
back.
Menards garages
You
out
were the
back.
guys that said they'll never leave. They'll never leave. Why would we change the tax? Guess what? They left.
It wasn't the tax,
Have you
Scott.
seen the amount of the?
It wasn't the
Oh,
tax,
Oh, now you change the
Scott.
All right,
subject.
It
Chris, back
wasn't
to
the
your
tax.
topic.
Well, here's the reality. There's not the economies, obviously, in natural gas. I mean, it's very, very abundant now. The prices are down, so there's got to be an incentive for these oil companies. Either work with the state, do it on their own. I don't have that answer, but incentivize them in some way to help build the infrastructure. So obviously, Rugby can get natural gas, and guess what? The great thing for everybody is now you got businesses there, and you at
Here's
home.
the
You
issue,
save.
though.
Give me a minute. You save money on your energy costs. It's a win for everybody.
But if I'm a propane dealer, you just screwed me with that.
Free market.
No, you said create the incentive.
So do you want to go sell horses and
Propane guy,
buggies still today
propane guy
too?
didn't get the
Those days-
incentive. Propane guy didn't get the incentive. That's all I'm saying. That's the only problem with the argument. I want these communities to have access to it too, but it's not easy.
You know what,
Right.
Scott? When we built that water system, I described the well drillers lost. The well drillers lost. And I fully opened and admitted that. Many of them are friends of mine. I go hunting with one of them constantly. He looked at me and he said, you screwed me. When you built this rural water system, used all this federal money, and I literally lost business because of it. And he's right. But you know what? The world for those farmers, the world for those rural communities is better because of it.
And you don't know that because I think right there, you're in some way, shape, or form, and look, I don't know the economies of propane, but might be denigrating propane deals. Find more efficiencies in your business then. Compete, go market.
Well, they will. I think they're saying they want to compete and they're happy to compete. I don't own any propane stock. I'm making the argument from their perspective. They didn't get any incentives to deliver propane to Bobcat and Gwinner, okay? And if now there is an effort underway that requires an incentive from the state or tax subsidies or whatever, or something similar to what Joel talked about, where water was done, they are getting a benefit to compete against the propane guys.
By the way,
you in favor of
the
laws?
well drillers got a huge federal and state incentive for geothermal.
Okay, what was your
The government haters?
a different way?
Yeah.
And I don't know if there's a similar argument with propane, but I'm just saying that's their argument the other way. On the other hand, I get this is stunting the growth in communities that could have an opportunity for manufacturing. If I was Gwinner and the concept of the possibility of Bobcat leaving, just turn the lights off.
And how
it's
happy is
over,
Gwinner
right?
if they've got lower energy costs?
Pardon me?
How happy is Bobcat if they've got lower energy costs?
Right, it'd be a good deal. There's no doubt about it. That's why there's an argument for fixing this. And I believe the companies are fixing it, but there's going to be gaps where there will need to be an incentive.
But you got to go to where it is. Where's the natural gas?
Well, there's no shortage of that, though.
No, but it's being burnt in the air, and North Dakota landowners and mineral owners, and the first
But Joel,
industry to come out is your buddy.
But no, listen, you think
It's the truth.
Do you think Harold Hamm gives two wits about the fact that
If you told Harold Hamm he had to collect that natural gas, he had to put it in a collection system and move it. He has to build something. He
we
would
have
subcontract.
we have told
done
Harold.
that.
We told all the companies, here's the amount of time you got to do this, get it down, and it's gone down, 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 down. Which
That's called regulation.
I thought
and
was
we
a little
did it.
heavy-handed myself because
I know you did. That's why I'm picking the fight.
But my point is, it's working. It's coming down. Well, it's stupid. What you're saying?
Yeah, it's not
if
stupid.
Joel
Not if you're the
Heitkamp,
mineral rights
had
owner.
been the governor of North Dakota during that time, he'd listened to the New York Times and he said, you know what? Shut down that oil well because you're kicking on a flare. And we would have lost. I know Rich Wardner's sitting here. He can tell us how much of a $100 bill goes to the state. It's more than goes to Harold Hamm, I'll tell you. And you know what? That goes away for the sake of saving your dollar bill.
I'll
It's
guarantee you
stupid.
if Joel Heitkamp would have been governor at the time that this all went on, I would have looked at Harold Hamm and said, that time increment that you get the flare is getting shortened up, so get ready. You betcha I would.
That's what they did.
All right, so last word on this topic. Joel.
Well, we're burning away profits. We're burning away money. Not only that, but we're willing to send money to Oklahoma and Texas that we had here. I've been against it all along. The oil companies, they get by with anything that they want because they got friends like this, and quite frankly, some of you. And the theory behind it is we should go on bended knee and thank them for coming and harvesting a one-time resource. And I'm not part of that team. I'm not.
All right, Scott, last word.
I think on the key topic here of the smaller communities that don't currently have access to natural gas, it stunts their growth. I like Joel's analogy on the water thing. I think that's worth the discussing. I would be cautious and to only use government incentives where there are gaps.
All right, Chris.
In other words, where the market can't support it.
Last word on this?
Yes, sir.
You said that we're flaring away money. The oil companies, it's hard for them to make money in natural gas. So what do you mean?
The mineral rights
owners?
owner gets paid.
Oh,
for
don't
that
give him
natural gas.
a window. It's your word.
So then, should they help support? Should they help support
He
the
threw the ball.
infrastructure? Well,
I know he
I'm
did.
asking. So should they help support the infrastructure to get natural gas to the rural areas?
No, what I'm saying is we are in control of what the oil industry does through regulation. Agreed? Okay, we're allowing them, and we did allow them for a very lenient period to burn off natural gas. That was money that we didn't look out for the mineral rights owner through our policies. That's my point.
Okay. I mean, I'm just going to say what I said before. You got to create some sort of incentive that allows these people, obviously, get it to the marketplace and do it in a way that's going to lower energy prices.
All right, so we're going to move to the next one. I think we're scaring our hot box people away, so please, we're not going to bite.
Other opinions up here,
Yeah,
right?
we do want other opinions.
Anybody?
We're going to talk about Medicaid expansion, and I know we've got an opinion on that will come to one of these podiums. So Medicaid expansion is where we voluntarily took Medicaid expansion into our state to cover more people. Originally it was part of the ACA, Obamacare, whatever you want to describe it as, but we as a state expanded it so that more people
Stupid?
were...
Could I describe it as stupid?
No, hang on,
Okay,
I'm
all
not
right,
done.
all right.
Wow.
You said we could describe it however we wanted to describe it. So
But
I
not
had-
yet, not yet.
Okay, all right.
So at any rate, we expanded it because we are concerned with rural hospitals. We're concerned with hospitals as a whole. And by the way, let me just say that we treat medical treatment in this country like a right, fund it like a privilege. And then along comes Medicaid expansion. We probably have to renew it this year at the legislature. Should we do it? Should we not do it? Now, you said it was stupid, so.
Well, Obamacare is stupid. Is there anybody in here that loves Obamacare? Please raise your hand. One?
There's one.
One hand here. Any other hand?
There's
Two?
several back there.
Loves Obamacare. 3, 4, 5,
Well,
6.
love is a strong word, Scott. I don't hate you, but I don't love you either.
Well, I love you, Joel, so I love everybody.
All right, let's not pick on the audience members, but let's
my
talk about
point
Scott's
is,
opinion.
My point is the reason I call it stupid is because I believe it is. I believe it's one of the biggest lies that Barack Obama told as president. If you like your health care, you can keep it.
But Scott,
Right? It's unforgivable, and I don't like what it does to states like North Dakota, where it says, "Do you want it? Here's the gun to the head. You know, here's the strings and everything that comes with it." So no,
so get rid of it in your opinion.
Absolutely, get rid of
Let's
it.
start with this. The healthcare system is broken in this country. We
Big
spend
time.
more money than any other country out there, and we still don't have as great of outcomes as other countries out there. So in my opinion, you got to obviously have the cross-the-state competition. That's just for starters. So with that being said, and then you focus in on the Medicaid situation, as he's saying, we're saying, oh, you're going to get 100% paid, then it goes to 95, and then it's going to be 90, and it's blown up from a cost perspective. So you and I are going to end up paying a lot more for the Medicaid expansion than was initially anticipated. So that's one aspect of this. But the other side, like Andy and I have talked about in the past, is that now because Medicaid has expanded, if you're a low-income person and you didn't have health care coverage before, now you've got something. So when you walk in that hospital in the past, you could walk in there without any coverage, but you don't have any money to pay for it. So guess who gets stuck paying the bill? Joel and I, who are paying higher health care premiums. So I don't know what the solution is there. All I'm saying is that if it's a wash where my healthcare premiums stay stagnant, because I'll tell you what, I'm drinking water, eating kale, running, doing things to take care of my health. I don't want to pay for everybody else that's out there, you know, eating potato chips and stuff. That's my opinion. So if you're going to tell me that, hey, Medicaid expansion is going to cover a gentleman that's got a low income and didn't have it before, and now my premiums aren't going to go up because the hospital is actually going to get some reimbursement for that, there could be a possible going, okay, that's a potential win for people.
Joel.
I think the health industry has a better answer than what I do. I agree with Scott that some of what was said about Obamacare, and I think he's going to like it being called Obamacare 20 years from now. I think he's going to like the legacy of that.
Who,
I think
me or him?
Hang on, Scott. I think that the Dwight Eisenhower would love the interstates being named after him as well. I believe that the whole misnomer that you could keep your policy, that was a terrible sale job. It was a good sale job, but it was terrible on the back end of follow through. I will acknowledge that. But what I also want, and when people call into my show to talk about this, I say this always, give me your old policy. Because I don't think that people really knew what their old policies did. And I don't think that they realized why their old policies didn't meet the criteria of what they needed for the future, number one. Number two, if we all hate government's involvement with Medicare so bad and Medicaid, how many of you, when you get to the age eligible for Medicare, are going to take it? You're all going to take it. You're all going to take it.
But that's
right?
not a fair sales
It
job.
is too a fair sales job because
not.
you hate how
You paid for
Medicare
it.
is run. You hate how the government gets involved in Medicare. But the first thing you do when you're age eligible is rush to a government
You want to know
program
the
for
second thing you
healthcare.
do is you'll get a Medicaid gap, private insurance to help shore
you
up the
should.
gaps.
And
but
you
then
should.
that's not a great system. If
It's
I'm going to
a
go get another
system.
private insurance
It's a
system
system.
to
You
make sure
talked
that's going to
about
subsidize
paying.
my Medicare.
Chris, you talked about paying. How were we paying before? America as a whole wasn't refusing medical services. What they do is they'd be in denial, they'd wait too long until it got out of control, then it was a big bill, they'd go to the emergency room, they'd get locked in. We all picked up for the bills that weren't getting paid. And instead of, and yes, did the Republicans have some ideas that would have been good to be in this law? Absolutely. Was there some common sense behind that? Absolutely. But you gotta come to the table. You can't just sit there and say, no, 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 no. We ain't doing nothing here. And how long did it take for Paul Ryan to come out with a plan? And that was, now remember, this started, the genesis of this conversation took place in Clinton 1.
Yes.
So come on,
Yeah.
this problem
Which
has
is
been around a
which is
long
one of the
time.
reasons I think your early prediction of Donald Trump not being elected is about as good as your prediction that Doug Burgum wouldn't be the next governor. But
I predicted Doug Burgum would be the next governor. Maybe you should listen
I
to the number one
shouldn't
rated
talk
show.
about. I shouldn't talk about. I shouldn't talk about.
You must have time with no callers calling. You should call in.
I seem to remember a conversation. We're on the air at the same time, so unfortunately that's not possible.
Oh, you'd be surprised.
I like good radio, but You did tell me one time when I was saying what I thought was going to happen in June happened, that you know he's not going to win. So I think you had evolving positions on that, but we'll leave that for another day. My point is on Donald Trump, I think Hillary Clinton actually is going to own a part of Obamacare, and it's part of the reason people distrust the government in such an extraordinary way right now. They are just fed up with it. Honestly is part of the whole Doug Burgum, Donald Trump success, Obamacare, because it was a flat out lie.
I just want to, can we save that tape?
We can
the
save
Doug Burgum, Donald Trump. I just want those two words used
there's
together.
All right, on that note, we're going to go to our local expert. He's been
Please.
waiting patiently in the hot box. Kurt, shed some light on this.
Well, I'm just enjoying the debate, the discussion. Fools rush in is what I'm thinking to myself while I've not said anything. So I agree with the discussion. Healthcare is absolutely a right. As a society, as a country, we are spending too much on it. Our system is broken. Medicaid expansion is needed. People need access to healthcare insurance services. I do take exception to some of the comments about when a person does not have insurance and they come into the hospital and then somebody comes in with insurance, hospitals shift the charges to that person with insurance to get more money. That is false. That is not occurring.
That's not what I said. What I said is that if a person goes in and doesn't pay, the hospital's got to make up for that expense that they're missing out on somehow. Thus, they're going to make my premiums and your premiums more to make up for the person that's not paying.
Well, hospitals don't increase premiums. Hospitals provide the services. The insurance companies are the ones
Right,
that...
so the insurance company is going to increase my premiums so they can make sure they can pay the hospitals that are asking for the increased costs.
And hospitals have, relationships with insurance companies where 99% of all the services we provide, we have fixed rates. We do not have abilities to, raise premiums, raise the charges and the reimbursement levels we get. The
You're saying that
challenge,
if I walk into a hospital today and I don't pay my bill, I'm going to get free care and no one's going to pay for that?
if you walk into a hospital today and you have insurance,
No, that's not what I'm asking. If I walk into the hospital, I don't have insurance, and I don't pay my bill, no one's going to, how does the hospital, how does insurance make up for that? Because nobody's paying for it.
well, the
you're saying.
insurance doesn't make up for it. It's the hospital that would work with that patient about their ability to pay. The mission.
And I just said I'm not going to pay my bill.
You're not going to pay. Then the hospital would eat that, and the insurance company would not have any. They're not going to have any skin in that. The hospital is the one that would have to take care of that service.
So the hospital's going to eat it.
Hospital would eat it. Yes.
So when you say you eat it, obviously...
Uncompensated care, bad debt.
What's that?
Uncompensated care, bad debt for the hospital.
One more time?
Uncompensated care, meaning we provide service for you in this
Right.
example, we would not collect from you, and
how-
so that
Somebody's
would
gotta
be
make
bad
that up.
How good
debt.
is my care going to be, and how long am I going to stay in business if I'm just eating people that aren't paying for
Well,
it?
that's a great
Hospitals?
question. Yeah.
Well, that's a great question. The average hospital profit or operating margin across the United States is less than 2%, meaning revenues are greater than expenses by 2%. That's shrunk tremendously over the last 10 to 15 years.
Kurt, how many hospitals in North Dakota are profitable? How many are there? How many are profitable? Just a rough guess.
I can't tell you how many they are. How many are profitable? I would say less than half at this point.
All right, and so how do they stay open?
Most of them are nonprofits.
But even a nonprofit has
The
got
bigger ones subsidize.
Not for profit does not mean nonprofit. At the end of the day, if revenue is not greater than expenses, hospitals are like any other business. They will close.
All right.
And so, how do they stay in business? Well, there's fundraising, there's endowments. Hospitals are challenged with looking for new ways to provide high quality care while taking waste out. That's what it's all about.
So are there hospitals in North Dakota that are in danger of closing?
Certainly, there's hospitals across the United States that are in danger of closing.
All right, and would this help this problem?
Medicaid expansion.
Yeah.
Medicaid expansion, in my opinion, is good for our society. It is good for the individual. A lot of the Medicaid expansion plans pay the hospitals 70% of their costs, not charges, costs. So picture yourself as a business owner and someone's coming through your door, and if you have a large percentage of your folks that are coming through your doors, they're saying we're going to pay you 70% of what it costs you to provide service. Unless you're redesigning your services, you're not going to be in business too long. So I would look at Medicaid expansion from a hospital standpoint. It is a starting point because these are folks that have benefits. But as a society, we still need to come to terms with how are we going to fund health care services, because in my opinion, what Affordable Care Act, Obamacare, whatever your term for it, has done over the last few years is it has provided insurance and coverage for individuals that in the past haven't had it, but that has not put new dollars into the system. Reimbursements to hospitals and to physicians have shrunk, forcing the system to be more efficient, which
Question
is
for you.
putting other hospitals in jeopardy of closing.
Question for you, Kurt. So I would be one that wants our hospitals, rural or not, North Dakota, to be properly compensated for what you're doing, right? And that's a reason, I assume, for your support of Medicaid expansion, to say that allows us to be properly compensated and not have those deficiencies. What I don't like about the Medicaid expansion is the strings that come with it, and then the reduction, right?
Yeah.
We're gonna here's something that'll solve a problem for you, and then we're gonna take it away from you, right? So is there a way you would do Medicaid expansion differently than how it is currently crafted that might, bring some more support?
I don't think I'm prepared to answer that. For hospitals, the whole issue with Medicaid expansion is these are individuals that now have insurance. Hospitals are not compensated at a level to break even by and large for what they receive from that. So it's a starting point. The Obamacare, the term is population health management. It is having these folks that have insurance that will view illnesses as prevention, as opposed to I have an episode of care that we talked about earlier. I'm sick, I'm going to go to the emergency room. We're trying to change the mindset so that individuals, before they get really, really sick, really acute, are seeking services and care at a lower level, which is better for them, but is also less costly for us as a society. We're not there yet, but this is a starting point with Medicaid expansion with regard to those services.
Kurt,
I think
thank
that's
you.
the glass is half full perspective of it.
So Kurt, don't go away here, because I'm sure that this panel is going to have more questions for you. I kind of liken this to a gas station, and the gas station is required to give gas to everybody, whether you can pay for it or not. So how do you solve that knot? I mean, what's...
Not going to be many gas stations left if that's,
Well, it's the same thing with hospitals. Eventually, they'll
I
go
agree.
away, whether they're nonprofits or not. You got to have money to pay your employees, and if you don't pay your employees, they don't come to work very often. That's a problem. So what do we do about it?
I guess I don't follow the question. What's
Well,
your
so
question specifically?
if you're required to give care to patients, you got to get
That's
some
what we
kind of...
just said, that Medicaid expansion could be a good thing. Now that you've got people covered, the challenge is obviously that the costs are being projected to be a lot more than what we originally anticipated. And as he's saying, because now the feds aren't going to pick up the whole tab, and we've got low oil and low ag, how are we going to make the $30 million shortfall?
I would argue we elect Donald Trump, just to make Joel go nuts over there, and not have Obamacare version 2 under
What's his healthcare
under Hillary. Well, they've crafted one. It's like basically the Paul Ryan plan. They pretty much just
Tell
said
us
the same thing.
the Paul Ryan plan in just a
What-
minute.
as a country, and you live in this industry, my question of you would be this. When you look at other countries, do you look at a country and say, you know what, they're doing it right? They're turning out a product that's healthier in the end and more affordable while we're doing it. Do you look at other countries and say, why can't we use them as a model?
I look at that, but I also say, do I see that being in this country? So just a quick example. Canada, England, national health insurance. If you break a leg or break an arm, it's not life-threatening. They have a certain quota, a certain dollar value they put on for treating those injuries, ailments on a monthly basis. If you go into that hospital or into that clinic at a certain point of the month and they've spent as much as they're going to spend on it for that month, and it's not life-threatening, you'll be put in a brace and told to come back at an appropriate time when the budget has reset. Is that something that this country would embrace? If I have smoked and I have need for lung surgery or a lung transplant in those systems, they make a decision and say, sorry, you've contributed to this, we're not going to cover that. Or your age is X, you need this surgery, the resources, the cost of that surgery are not best spent on you as an individual, it's best spent on society for other things, you don't get that procedure. As a society, as a country, are we prepared to embrace that?
Okay. Thanks
All
for
right.
your answer.
Sure.
Thank you. Joel, you've heard this whole topic about Medicaid expansion. Does North Dakota continue down this path?
Well, they will. I mean, they will, because North Dakota wants hospitals open in Oaks and Lisbon.
Okay.
That's why they will. In fairness to the Rich Wardners of the world, this isn't why he ran to be a legislator, but Rich has a heart, and Rich understands the need for medical care in close proximity. I think one of the things that we always ignore when we talk about the cost of medicine is we ignore the cost of long-term care. And we talk about health care as the emergency setting. That's easy. I mean, that's easy. We never look at the real hardline costs of what we're paying in terms of long-term care. What many of us do is we pour down grandpa or grandma, right? We make her a ward of the state. And then we don't feel guilty about it at all.
Yeah.
I mean, we have people that in their lifetime have owned quarters and sections of land, and we make them be as poor as we can possibly damn please so that we can put him in one of his facilities and tell his full-time care facility that she's past the independent living stage, she's in the assisted living stage, and by the way, pretty soon we're going to need hospice, and find a way to pay for that too. And we as a society, culturally, find it okay.
Sure.
And so until we, on both sides of the aisle, sit down and recognize what we as a society do, we're not going to fix it. And it can't just be done by one party saying we'll address the problem.
I think we have another agreement here. Scott is shaking his head.
And I'm with Joel on that. I mean, remember how they passed Obamacare? It wasn't with Republican support, right? I mean,
They wouldn't even come to the table and talk.
Yeah, no, but you know what? Because it was a piece of crap legislation, and we proved all
What did
that
you
out.
offer?
But did you agree
You
with
know,
this
What
point
did you offer?
Hang on a minute. We actually got to something for a second, and you were almost
I
agreeing.
didn't like it anyway.
Okay. Well, the one piece you're talking about is changing the laws in our public policy so you can't spend down your assets in later life. You went there, and you almost went there.
No, I mean, there's reform necessary there as well. I'm just saying, where Joel's talking about sit down, figure out, find a way to do that to help. That's the thing, and I'm reminding everybody there was no Republican support for Obamacare. We said it was a disaster. If you want to say Mitch McConnell was a jerk and didn't provide enough of an alternative, fine, whatever. I mean, that's I'll take my ball and
Mitch
go home.
McConnell was a jerk.
Yeah, I mean,
here's the truth. You grab people like him,
Yeah.
and you put them in a room, and you grab people like my wife, who's the head of hospice and home health for CHI in North Dakota, and you set her in a room, and you say, look, develop a product.
Yeah.
I don't give a shit what your politics are. Excuse me. I don't care what your politics are, right? I don't care. I don't care. Democrat, Republican, whatever. You understand it. You know it. You need it. Come out with the product. Then deliver it to him. Deliver it to me. We're in the legislature. Yeah. Let's take a look at
Barack
doing it.
Obama.
But you can't do that because your premise, your line in the sand, has been let private industry handle this. Let private industry handle this. When the truth of the factor is, government had to get involved.
Well, I mean, and I believe Obamacare was really just a path to single payer. I think that's where Obama's been a long time. And
I agree with you.
I think that's why they went this route, and I think Republicans saw that coming and said, I'm not going to be any part of it, so we got a chance for a reboot, so Donald Trump will start that here in a few months.
Good luck with that.
Chris and I will be at the inaugural, and we'll get him to,
All
come
right.
to North Dakota first.
So Scott, sustain or reject Medicaid expansion?
I'm with Joel there. I don't know that these guys are going to have a lot of choices right now, to be getting creative and saying we're going to risk going it alone a little bit. It's a gun to the head. I don't know with all the battles to fight in the upcoming legislative session where that's going to go anywhere. It's a stink bomb, but I think we'll all hope that it's better with the next administration.
Chris?
I think that we're stuck right now. We've done it. We're probably going to have to do it again. The question is, are we going to be able to obviously pay for the costs that we're going to incur? And the big thing I just want to, because I get the feeling this is my final word, is we got to be honest right now. Our what we dub as a healthcare system is a disease management system. Right. I think we need to reframe ourselves to go, what are we going to do to start focusing on actual healthcare rather than disease management? So as we get to these long-term care issues, they don't have a hockey stick situation to them. Thank you.
Yeah. All right.
Terrible example, analogy, I'm sorry, but look what the federal government did to us in rural states, okay? I know I'm going to get in trouble for saying this. You didn't get your federal tax money unless you went to 0.08 on alcohol.
They do it all the time.
Right?
Yeah.
You were at 0.10 on alcohol. Unless you went to 0.08 on alcohol, you didn't get your federal money.
Yeah.
I'm sorry, but there's 10
like
miles
$100,
between the Manor
yeah.
VFW and my home.
I will piggyback.
And I started behaving better, but
I want to piggyback on Chris's point on this to say the transformation I believe is the idea that I go to the doctor and I really don't have much skin in the game in what the price is for what I'm asking for. I want everything. Give me one of everything. It's like a buffet.
Sure.
Right? So and because I got insurance and my deductible's here and I'm good. That will never work. How would that work in anything? Right. If we did that with groceries and said, okay, you got X, you pay grocery premiums every month, and then you just go get what you want. Oh, I'm going to get the biggest cornflakes. I'm going to get the big, So to me, it's just the most messed up system.
I'm going to get steak, not cornflakes.
We need people to own their own health care,
okay.
to have skin in the game, and get to a point where we can do true transformation of how the system is.
I'm going to give the last word to Chris or to
Our friend
Kurt, thank you.
No, I agree. We need to transform our healthcare system. The current system is not good for the individual. It's not good for businesses. It's not good for the government. And hospitals, by and large, and physicians are not thriving under that. I agree with the comments that individuals have to have a stake in their health and in their lives. There needs to be prevention. We need to identify disease and illness at a lower level because it keeps people out of the hospital. In the future, hospitals need to be places just for the very sick. And it needs to be a societal emphasis on that. And we're taking steps in that direction, but it will take years.
So you're in this business every day. How do we start that to change the paradigm so people are going, okay, I'm going to focus on health rather than disease management?
And truly the last word.
That's a complex answer, but insurance companies, CMS, hospitals are working together now. If a patient is discharged from the hospital I work at and is readmitted in the next 30 days and they have Medicare, when we treat them again, we do not get reimbursed for that. So we have incentives to make sure we're doing the right things. If a patient comes into the hospital and they contract an infection, we do not get paid for that by treating that. So there are financial incentives there beyond the quality and the emphasis on quality of care to do the right things for the right people. And our healthcare system is starting to pivot, but it's like a big ship in the ocean. It will take time.
Thank you.
Well, as a first lady, you sure don't go into schools and teach them about nutrition, because you get beat up for that too, right? Yeah.
All right, let's talk, thank you, Kurt. Let's talk about the last topic, and then we'll have a kind of a du jour session. And the last topic is about the bills that have been circulating around some of these state houses, bathroom bills and religious freedom bills. And it's no secret that North Carolina's been there. I think South Carolina's done some things. Mississippi, other states have gotten into these bills. Controversial, obviously. When these came up, we met with our board of directors and talked about discrimination, and they said, we absolutely do not support discrimination. Now, that said, we think some of these may come to this session again, and we know for sure that one bill will be introduced. What do you guys think about these bills around the state houses? Should North Dakota go there? Should we stay away from them? What should we do?
I think we should stop having these bills come up at all, because I think they're designed to stir this pot. And all the things that we worry about happening as a result, right? Are people, 2279 in my view was written so poorly as to they had to know it had no chance of passage, and wanting the issue to try and pick up a couple of legislative seats in Fargo.
So talk about 2279 for those who don't know what 2279 is.
Well, it was the last, it was the idea that there should be special rights for individuals because they felt as though they were being discriminated against because of their sexual orientation. And they wanted to, but it was a lawyer's dream. Clearly the Schneiders had a lot to do with it, because I mean there was a lot of money to make for trial lawyers going after things, which is a bad thing. But my deal is, look, the makeup of the legislature in North Dakota is not changed radically, won't change much. We're bringing these up really just to have a fight that really is a problem in search of a solution.
So if it was a different bill, are you in favor of discrimination based on sexual orientation?
Of course not. And the bills, we already have that. I mean, this
Would
idea
you have
that
voted for the bill in North Carolina?
The idea that the Greater North Dakota Chamber has to have a board meeting and say, are we for discriminating? No, we're not.
Would you have voted?
Scott, in our defense, let me just say that, listen, we talk about a lot of these topics in these meetings. So it wasn't a special meeting we had, but we brought it up as an awareness.
The genesis
they
of
went
this
right there
debate
and said,
didn't come from people looking for rights for transgender people. That was happening primarily locally. The genesis of these bills came from the far right and the Tea Party when they were in North Carolina and places like,
Joel.
and then people responded to that. People responded to that. Yeah. People said, you know what? If that's the way it's going to be, then we're going to respond here.
Listen,
whatever happened to Cliff Rowell?
Excuse me?
If Cliff Rowell, my school superintendent, had this issue in his school, he would have dealt with it.
And that's the way it should be dealt with.
Exactly.
School
but
by
you know
school.
what? You guys started
Your president
this.
right now, your president and your party likes the idea of people being able to choose which bathroom they go into, which locker room at a school they go into. You should be shouting more than anybody, say that's going to assure the destruction of the Democratic Party in North Dakota, I'll tell you.
When you run around, you know why? Because it's not an issue.
Well,
It's
thank
not-
you.
it's an
Well,
issue
there's
you
2279.
created. You
guys
created
it.
Wait.
All right,
You
let's
created
have
the
one at a
issue
time.
for
Let me get
votes,
this
for
out.
money.
A
You
gentleman-
wanted the conservative right, the Christian right to come pour money into you, and oh my God, little Johnny, you're going to protect him. It wasn't an issue.
This is
You
the
made it an
story.
issue.
We agree.
So
Chris.
I want to excuse me for how this comes out, but this is the actual story. In Boston, a man walked into a woman's restroom, exposed himself, urinated into the sink, and said, I can do this. This is a man's bathroom now too. So you're saying it's not an issue.
Arrest
These
him.
women, great. But he did it because he feels like he's got the right to do it.
I was at the Fargo Dome the other day for a concert where they don't have enough women's bathrooms. Woman coming in while I was taking a whiz, and you know what? They came and arrested her.
So-
Quite frankly,
so are
I
you
didn't care
okay?
that she was there.
So you've got daughters. You okay if a guy walks in the bathroom and urinates in the sink while your daughter's sitting
I
there?
don't think there's enough instances at this that it doesn't need to be
Thank
dealt
you.
with locally.
Same thing happens on 2279.
You started
Are you
this.
agree with me on 2279?
I don't know that I would have voted for that. I don't. My point is
that's
this.
my point.
The fight started in North Carolina.
I'm
and
not
you
from
know
North
it.
Carolina, and I'm not going to defend any conservative that started it there. My only point is I'm talking about here, now. And I'm saying I think we agree that 2279 will do what is happening in North Dakota, North Carolina.
Let's talk to the
Stir this
Genesis.
up.
Yes, we've got
2279.
the author of 2279, Representative Boshi.
Thanks, Andy and everyone. Couple different points that have been brought up here. I think, first of all, Joel, you have it exactly right. In terms of North Carolina, the local city control passed an ordinance that said that they weren't going to discriminate against folks. And then the state came in and said, no, you can't do that. And then they took away even farther the original language that we have similar to our North Dakota Human Rights Act here, which involved religion, gender, disability, race, and so forth, saying that local entities couldn't pass laws like that. And that's where, you know, the Obama administration, I think, has overstepped. They haven't had any direct action yet, but by sending their dear colleague letter, I can tell you in North Dakota, it's not an issue in the fact that if we're talking about bathrooms and locker rooms, transgender youth in schools specifically, since the last legislative session, I've had 5 school districts reach out to me, whether it be a superintendent or a school board member or a principal, and say, this is what we're experiencing. What should we do? And I refer them to the North Dakota School Board Association, and then I send them a link to the Gay, Lesbian, Straight Educators Network that has a preferred policy for the school to do. Every one of those schools handled it on their own. And that doesn't mean necessarily that you're letting a transgender young person go into the bathroom. It means that you sit down with everyone and you say, what's the solution? Because everyone's concerned about safety, including that transgender young person. So a lot of times it means, well, then you can make sure you go home and shower if you're in a rural school, or you can use the coach's locker room and the coach will stand outside and use that so you have some privacy. And on top of that, they provide that accommodation to any student that feels that privacy is an issue when they're in the bathroom or in the shower room. And so I think to agree with Joel, I think it's a mountain made out of a molehill. Local school districts have been solving this on their own. In terms of 2279, which many of you as employers and businesses supported, Scott, it's the same bill that we introduced in 2009. We've been having this conversation in this state for well over 6 years now. And so there is no hidden agenda, there is no private funding for the Schneider law firm to make more money off of this. It comes off the fact that there are North Dakotans who have said, I have been discriminated against because of my sexual orientation or gender identity. And until this last session, when the Department of Labor said, we'll start tracking that, because before, if I had called and said that my employer, Hatch Realty, discriminated against me because I'm gay, the Department of Labor would have said, you know, we're really sorry to hear that. There's nothing we can do for you. But now the Department of Labor is tracking those calls. And since the last we heard was June, since last session to that June, they've had 10 complaints already. So the fact that it's not an issue, I think, is dishonest to the people who stood up and said this happened to me, and at the threat of continuing to be losing their home or losing their job. It's a reality. We see it.
Yeah, I would
If
just...
anyone in this room has been to a Twins game, been to the Mall of America, been to Valley Fair, you've used a bathroom where these laws have been on the books since 1993. It's not been an issue, it's not been a problem. There is one incident in Boston, there was one incident in Washington, and as Joel says, you arrest those people, because those people are in the wrong.
I want to go back, though, to Josh, to 2279. Would you agree with me that as that was debated and discussed and the aftermath after the vote was an ugly time?
What do you mean by ugly time?
You know, just the atmosphere, you know, the different things that were done, the boycotts of coffee shops, and you know, the pictures in the paper and the back and forth. I mean, it was in my mind, it set back, you know, just kindness from one person to another a long way over that piece of legislation. I thought it was pretty contentious. Did you think it was, Joel?
Well, I think it was contentious because people care about it on both sides of the issue.
Right, and I'm
And when people are trying to decide if I'm going to move my family to North Dakota to fill one of our 20,000 job openings,
Let me
should I
answer
do
Scott's
it
question.
at that
Okay.
risk?
I've got Jim Casper telling me that a landlord should have a right to evict someone out of his apartment because he's gay. Right, Scott?
Well,
I don't think that's right.
Yeah,
if that's your question, I'm voting for Josh. I'm not voting for Jim.
Yeah, no,
That's my answer.
I mean, my whole point on 2279, there are laws in place. There's a federal law in place. There are state laws in place that deal with all this. You know, and we asked for examples. A lot of examples you guys couldn't come
Scott,
up with
can
any.
you point to which state law that is? Because the Department of Labor can't tell us what law
Well,
that is.
you just said they're tracking instances of what?
They're tracking, but there's nothing anyone can do.
Yeah, well, you know, my point is we have this in place. I worry about, by doing what you're doing, in what I would call stirring the pot, bringing it back up, you make all the stuff you're concerned about that much more likely, rather than addressing the 10 things the Department of whatever has got a note on. And
But they
deal
have
with
no
every one of
authority
them
to address those
within
10
laws that
things.
currently exist.
That's what
because-
this law says. This law says you have the authority to investigate if this really happened or not, or is it just a story someone made up?
Yeah.
Andy, I'm going to add this to the conversation, just so you're clear on what my record is, and I'm done running for office. But the ACLU came out, and this was back in the 90s, when they were talking about gay rights, and they were talking about the ability for people to live a successful life and not be discriminated against. And North Dakota was at the height of this whole far right, and what happened was, the worker for the ACLU said that he was going to out a number of legislators that were gay. Because in my whole time there have been legislators that are gay. Josh is one of the few that has come out and said, I'm gay. And you know what happened? He got reelected. He's going to get reelected again because people don't care, okay? Here's the point. The next morning at my desk, I had a very prominent Republican sitting at my desk. He hadn't slept all night long. Hadn't slept all night long because at that time in his political life, he believed that that was the end of his political life. I agreed that that's disgusting. It's wrong. You don't out people. I went to the ACLU, I went to the Attorney General, who at the time, I happen to know the code for the office. We called the ACLU got him out of this state, and you know what? He killed himself. The guy killed himself. And I oftentimes look back on that as one of those moments in government when I go, I know I did the right thing, but there's ramifications for everything. I think he was obviously mentally unstable in the first place to have gone down that road. But he went looking himself for a problem that wasn't there. If you can't get their vote, Randy Baining, who since has come out and admitted he's gay now, right? Or lives a gay lifestyle. Randy Baining didn't vote for Josh's bill, and I respect that. He was elected by his district. His district will choose whether they should reelect him based on that. That's the way the process is supposed to work, right? I can still like people that don't vote a certain way on a certain bill. But this fight, this national fight, started in North Carolina.
Right.
That's where it started.
But so what do we do here? And Josh, I'm going to bring you in a second. I mean, you say it's stirring the pot. I've heard a lot of people talk about, oh, we need to do this for workforce issues. If you do your research, you look at Cass and Clay County from 2010 to 2014, meaning Cass, outpaced Clay County by like 6 to 8 times. And oh, by the way, Minnesota passed the laws that Josh talking about in 1993. I think it was 2010. They legalized same-sex marriage. They've got all this stuff here that people are saying, and I think you say this, but I know people talk about people won't move to North Dakota because we haven't passed these laws. The data does not back that up. So my question to Representative Boucher is it Boucher or Boschee? Which do you prefer?
Boucher.
Boucher is, what's the answer? Because I want to respect, I don't want discrimination. I think discrimination is terrible. I don't want anybody to
Do you
discriminate.
support gay marriage?
Hold on. I don't want discrimination. Give me a moment. And then what I want to see is how do I also respect people's religious conscience rights? So what's your solution to that?
Well, I think to address the comparison between Cass and Clay and the growth in Cass County, passing this bill isn't going to solve our workforce development issue. It's a tool in the toolbox of attracting talented people to come here. When you think and we talk about diversifying our economy, we're talking about the tech industry, we're talking about UAS, both of which these employers, as they grow here, are some of the leading employers and businesses in the country that have had policies like this because they know it's good for business. But if we as a state were to pass something like in North Carolina or continue to not want to advance the conversation, let's continue to have the conversation. Doesn't mean the bill is going to pass in 2017.
Yeah, but that's
let's
the
continue the conversation.
That's where I stop you.
So we shouldn't talk about stuff?
Continue
Isn't
the
politics about
conversation.
coming to the table and having a conversation?
Well, no, I'm
trying to
just
ask
saying,
Josh
some of the
what's-
same stuff you're complaining about, you are causing by this continue the conversation. Why don't you deal where you find problems with problems? And I don't buy that you don't have the tools to do that. You do. There's a federal law in this country.
He brought people in to testify during the session that had been discriminated against and they were ignored. Scott, don't go down that road. Go read the testimony.
Ignored. I
Get
think the
involved
point
in
was
the
there was a
process.
recourse
or
for them with it-
understand it. He brought people in. They stood right there in front of the Legislative Assembly, in front of those committees. They pointed out their discriminations, and they were ignored.
How many did you
They're a
bring in?
minority.
What do you mean by ignored? Didn't get your way
Chris,
with
it
a
would
vote?
be
I mean,
about
a bad
7, I
bill?
think, people.
Well, you just
About
said.
7.
Go
This
back to
time.
what you just said. Go replay it. There were people discriminated against.
I'm saying to the extent that you have individual cases of people that have been discriminated against, which again I'll echo Chris, is horrible. I love everybody no matter what. I hold no malice whatsoever to a human person for any reason, okay? So this isn't about, I don't like your lifestyle, so I don't want you to live there, and I want to fire you from your job. It's not that at all. It's that we have recourses right now. There's a federal laws for this. You can't just kick somebody out for any particular reason.
He just challenged you on the federal law.
I think when you
he
do
just
this,
challenged you on the federal law.
well, we disagree. But I asked Chris Dodson. Chris Dodson, get up here and tell him about what I'm talking about. And the same thing on, by the way, the bathroom bills. There's things in place already. Enforce the laws, but you're getting all the things you're complaining about, i.e., we want to attract people here. We want to be friendly.
How has gay marriage hurt you?
We want to let the gay community
How
know.
has gay marriage hurt you, Scott? In what way does it diminish you and your wife's lovely marriage?
That's such a rabbit trail that I don't want to go down right now.
So
It has
why would
nothing
you
to
not
do with
vote
what
for
we're
it?
talking about.
Why would you not
It's
vote
not,
to
it's
allow
a
it?
problem in
gets-
search of a solution.
That gets to the heart of what I'm asking.
It's a solution in search of a problem.
But I think what he's saying is, to me, it gets to the heart of what I'm asking Mr. Boucher, and that is, where's the balance, Josh? Because I do believe marriage is between a man and a woman.
Absolutely.
I've had conversations with you and other people about this that are homosexual and said, look, you can have every single right that I have. I don't have any problem with it. You can have all the legal protections. If your partner gets sick, yes, you should be able to go to the hospital and see that person and be with them and do all that stuff. I just don't want marriage as a man and a woman redefined. And so what I'm trying to ask you, Josh, is
but
where
that's
is...
why I ask, how does two women who love each other, who were born gay, they didn't wake up one morning and decide, you know what? Oh,
Do you have inconclusive research
if
that
you can't tell that
homosexuality-
somebody's gay, then you have terrible gaydar. I mean, the truth of the matter is there are many people I know, and I have known that were gay for a long time, and God made them that way. So why would I take away their right to be
I'm
married?
not taking away any rights. I'm
Sure
saying,
you are.
no,
You're
I'm
taking
not.
away-
I just said,
And
if
you
you
know
want
how
to go
many
to the
legal
hospital
rights go along
and
with
go
marriage?
be with your mate, I have
Do
no
you know
problem
how
with
many
that.
legal rights go along
That's
with
what I
marriage?
just said, Joel. I said,
let's go
you
back.
can have all the rights you want. That's fine with me. I just think, in my opinion, that marriage is defined as between a man and a woman.
Don't invite them to your house.
So Chris, to
let
answer
him
your
get
question.
By the way,
ridiculous.
I-
That is. Did you hear what I just said?
Let 'em
Don't
get
sit
married.
there and
Gentlemen,
make me some
let
kind
'em
of
get
bigot like you
married.
like to do. That don't
Let
invite
'em
him to my
get
house.
married.
You know that's ridiculous, Joel.
Chris, why?
You know what you just said to
why
me is
can't they
absolutely
get married?
ridiculous.
You didn't give me an answer of why they can't get married, other
Don't
than
even
your
put me in that
feelings.
box.
So let's-
Representative Boucher, what I want to know from you is, where is that balance?
Well, Chris, to begin with, to have that balance, we have to have a conversation, right? And so that's through introducing laws when it comes to state statute. And so we should sit down and have that conversation. I think a little known fact people don't realize is the first bill, when we introduced it in 2009, Senator Tom Fiebiger introduced it. North Dakota has been one of the only states, first of all, we were the first state to pass this piece of legislation out of a chamber on its first try. Second of all, we had just as many Republicans support the bill as we had Democrats vote against it in 2009. So it's always been a pretty good bipartisan conversation, both in support and opposition. This last session was the first time all Democrats actually voted for it. And so it's been a continuing conversation that we have. And as we have that conversation, we try to find those solutions. But Chris, in order to have a conversation, people have to want to come to the table. And so when I approach members of the Senate Judiciary Committee to say, how do you want to change, or what amendments can we talk about to make this better so you can support it, and they don't return my phone calls or my emails because they don't want to have the conversation. Or I reach out to the North Dakota Catholic Conference and I say, I understand you have a lot of concerns about this, and let's sit down and have a conversation. And they were willing to sit down and have a conversation, but they said nothing you can do will make us want to support this bill.
Okay, so let me ask you this way.
And so if we can't have a conversation, then we cannot talk about
is
how we
something
change
that's
this to
important.
make
You
it
mind
work,
if I
to
ask
find that compromise that you talk about. And I think the business community definitely wants to have that compromise because they want to recruit talented workforce. They want to retain the students that we're educating who are either North Dakotans or come here to our university system.
Josh,
and
what I'm
that's
hearing
why
you,
this is
what
important.
you say to me is a bunch of politics speak about, what I want to know in your heart is what works for you? What would make you feel like this is a fair balance, that, you know what, I can respect people's religious conscience and I can walk through my life and not feel like I'm being discriminated against?
So the only solution I have come to is if we were past this legislation and someone chooses that they want to discriminate against someone at their place of business, then in order to do that, you file with the Secretary of State so that the traveling public, so that the public knows who provides what services to whom. And let the marketplace then speak for itself in terms of whether I want to frequent that business or if I'm okay with spending my money at that business or not.
Thank you.
All right, last word on this. Thank you, Representative Boucher. Scott, last word.
Conversation's always good. I think it's very good. I think if you're going to try to do 2279 and use it for politics to pick up a few legislative seats when you're going to have a fight, it's dumb. I'd have the conversation first and worry about the legislation last.
All right, Chris.
I don't know anything new to say. I mean, other than that, I don't want discrimination. I also want to be able to respect people's religious conscience rights, and Josh shared his balance, and so if we can find that happy balance, which I know it's tough to find, then everybody's happy.
Joel.
The Republican Party just went to their primary and voted to put on the ballot a candidate that supports gay marriage. Josh is winning.
All right, thank you. So, no more words about this. We're going to talk next in our final topic about constitutional carry. Who knows what constitutional carry is?
Walk in, pass a background check, and buy a gun.
So constitutional carry is, essentially, help me out, Scott, is that you don't need a permit to carry a gun and you can carry it on your hip really anywhere, any place, any time. Now, I think that certain states can pass some restrictions. Is this a good or a bad thing for North Dakota? Joel.
I've grown up and been around guns all my life. I'm never too far away from a gun. So guns don't scare me. I've had guns pulled on me as a radio talk show host. I don't know if you guys have had that.
I've not had
There's
that
a guy in my lobby that the cops had to come
Come to the right side,
get.
Joel. Come to the right side. Nobody pulls guns.
Actually, I think
on
he
you.
was a relative of yours.
Joel, you got one right behind you, buddy. Hey, over here. Got
There
one
you
right
go.
behind you.
Pointing one back there.
And I don't
Careful what you
fear
say.
it. There's been a lot of circumstances in life where I believe that had a gun been present in the right hands, it would have went way better. So I really differ with my party's opinion on guns. I always have. I always will. I always try, when they tell me what an assault rifle is, I always tell them, show me. Show me what it is, because they just look at the military style of it. They don't realize the sheer mechanics of it.
So Joel, if you're a legislator, you're going to vote for constitutional carry?
I wouldn't have any problem with it.
All right,
I wouldn't.
Chris.
Yeah, you pass a background check and you are Second Amendment, go get a gun.
Yeah, more guns, less crime, every time. John Lott's done some incredible research on this.
Chicago?
Yeah, no, I mean, more guns, less crime. I mean, it's a simple fact that it is concealed carry doesn't scare me. I empathize with law enforcement a little bit when it comes to situations where
This is not concealed, though. This is you can have it right openly on your hip.
Yeah. So I mean,
It's all the better for guys like him.
Yeah.
If he can see it, then he knows what he's up against.
We're going to ask him about that. Chief Donlin, welcome.
Yeah, I mean, there's no issue. It's not an issue when it's the good guys with the guns, but frankly, when two of you walk up, talk to a law enforcement officer or whatever, and you both have a gun, I don't know if you're a good guy or a bad guy. And law enforcement's mind right now, the only good guys with a gun is the ones in uniform when there's guns present. If we respond to an active shooter, anything like that, and you've got 5 good guys with guns trying to get that one bad guy, that's a great thing. But when law enforcement shows up, they don't know who's who. And a bad guy with a gun can say, wait, I'm the good guy, and then he gets the drop. So when you get, training is huge. If we're gonna go that route, there's got to be some mechanisms in place about education to the public, when they can use deadly force, when they can't, gun safety, responsibility and accountability, many things like that. And the fact, even in this room, in a church, in a school, I could go for hours in talking about scenarios. We've got this, most people I think have this black and white thought of active shooter walks in, good guys with a gun take the active shooter. That's great if you know who it is when the gunfire starts. But right now, if there were 6 people in here with guns and one of them was bad sitting in here, and all you heard was gunfire, and everybody kind of drops and starts running, and when the dust clears, you got 6 people with the guns, and maybe nobody even saw who the bad guy was. Now, who do you shoot? Who's the good guy? Got to have some training. It's the thinking part that's really important. Carrying a gun's easy. It's the training and the thinking part that goes into it.
Thank you. Representative Becker.
I think to have voice an opinion in opposition to constitutional carry is an extremely difficult argument to make. Like, for instance, I've got a fake gun on me now, right? I was carrying under my coat jacket. Now, in North Dakota, to be able to do that, even just to walk like this, I would need a concealed weapon permit. So the constitutional carry, which is permitless carry, just means I don't have to get that permit. I can still do this. Now, one thing I want to potentially correct you on is if I took my jacket off, I can do that now. I could walk around with this gun on my hip with no change in the law whatsoever. I don't need a permit. So that's something important to know. This law simply makes it that if I want to put my jacket on, I don't now have to go get a permit. Or if I don't have a permit, I didn't suddenly become a criminal by putting my jacket on. The other thing is, if I was walking around without my jacket at 7 p.m. in July, that's legal. 7 p.m. in December, that's illegal because it can't be after dark. So when the Second Amendment says that the right of the people to keep and bear arms shall not be infringed, I think you have, number one, shouldn't infringe it. But number two, if you're going to, you better have a darn good reason. By having a permitless carry, and which, by the way, I have a Class 2 concealed permit. I didn't have to fire a gun, I didn't have to handle a gun, I didn't have to do anything except jump through hoops that the government said I need to. So, and I'll just wrap up my little comments just for education purposes. In this bill, if you're under 18, you cannot conceal carry, with or without a permit. If you're between 18 and 21, you need to have a permit. If you're above 21, you don't need to have a permit. However, the permit process, but for both Class 1 and Class 2, stays in place so that people who want to have reciprocity and carry into other states can. Right now, the law enforcement have to assume that whoever is openly carrying is just as much of a risk as anyone who they can't see a weapon on. They have to take precautions for everyone. And the only people that are bothering to get a permit are the people that aren't going to misuse their guns anyway. They're law-abiding citizens. We could go into the whole thing with the Second Amendment, but that's the basis of constitutional carry.
I have a question for Representative Becker. In the bill, are you looking at it making it residents only? Because there are states that do have constitutional carry, but it's for residents. What happens when somebody from Texas, somebody from Utah or whatever, Wyoming, comes into North Dakota? Anybody across the country can constitutional carry or residents only?
That's a great question. I have to look at that.
Okay. That's an issue that we really think needs to be looked at and make sure that's cleaned up.
Sure.
I want to say this to the police officer. Don't you assume that everybody's got a gun now?
I'm hoping I'm the only one. There's a saying in law enforcement: be professional, be respectful, be kind, be courteous, but have a plan to kill everybody.
Exactly.
Have a plan to what?
Yeah. Exactly. So I'm assuming everybody in here's got a gun.
All right.
Well said.
Thank you so much.
Hopefully Warren Donovan is not in the crowd.
We're going to go into, in a minute, a lightning round, but I want to kind of get last words in about this whole topic. So, Joel, I've picked on you a lot of times to go first. Last word on this thing?
Well, I think that all of this is, I assume that everybody has a gun. I do. I assume everybody has a gun. Everyone I know has a gun. My wife doesn't like guns. She made me get a gun safe instead of a gun cabinet. Remember when gun cabinets were cool? So you could show the 870 that your dad bought you when he won the World Series pool. Yeah, that was a cool day. So guns don't scare me. And I think that anyone who thinks that guns aren't going to get in the hands of bad people is an idiot.
All right.
I don't have anything to add. I mean, I spoke my piece. I'm good.
All right.
Ditto.
Ditto. All right, so we're going to do a quick lightning round. We just have a couple of moments to talk about any topic you want, and time to sound off.
I want to talk a little bit about this protest out at the Dakota Access Pipeline, which I'm sure folks are watching pretty closely, and I hope the Greater North Dakota Chamber is watching as well. In this case, a company that has done everything correct, Energy Partners and the Dakota Access Pipeline, gone to the PSC, gone to the Corps, gone through years of development, was asked to follow another pipeline route so they would disrupt the least amount of environment. That's why the major study that the tribe is now complaining about didn't happen, the extended environmental impact statement, because they followed routes where they had been done recently. Everything right, was asked to stop construction of this project in our state. And the reason it was stopped was because I think reasonable has prevailed to say there is people's lives that are in danger right now because of the construction of this pipeline. But I've heard estimates of $400,000 a day is the cost of that. And now obviously there is a court hearing as well on this. We, right now today, we're New York Times the other day, I see Bernie Sanders put out a press release today talking about North Dakota. The protest group has come out with a statement saying that they want the Obama administration to intercede with the Corps and not let this happen, which wouldn't be unlike what they did with the Keystone XL pipeline. Pay very close attention to this. First, on the fact that there are lives in the balance, and I want your sister, Senator Heidi Heitkamp, to get more involved because she is pro-energy and has demonstrated that, and she also has a good relationship with the Obama administration and the natives.
Well, I think you stretched the Obama administration.
I've been well, I know it's not popular to say it, but she's the one person to get her calls returned. Nobody else would. And I'm worried about the security of it, but more importantly, Andy, for commerce. If some thugs can come here from all across the country and shut down a lawfully permitted process, we're in big trouble. And if they sense blood in the water, they'll be back. So that's my worry. Pay attention.
So I'll speak to that because I think if it was lawfully permitted, you've got to ask yourself, then why didn't the judge make the decision yesterday? This is an Obama-appointed judge who's also the same judge that earlier this week, or last week it was, when he said, hey, Hillary Clinton's got to release those 14 or 15,000 emails from the State Department. Now, I've been doing a lot of phone calls on this. I called the Army Corps of Engineers. I called the attorneys at earthjustice.org that are obviously representing the Standing Rock Sioux tribe. And the riff right now is that there's a National Historical Preservation Act, and what they're saying is that the Corps did not follow that because you've got a pipeline that's running through sacred ground and burial grounds. I called the Army Corps about that. I couldn't get clarity if Colonel Henderson down there in Omaha actually spoke to Chairman Archibald to say, yes, we did the right thing by visiting with the Historical Tribe's office. And that seems to be the missing element to me, and I think that's what that judge is trying to find. So I'm upset that obviously we've shut down commerce. I also have a soft spot in my heart for Native Americans. I want to make sure that we're following the law, and if the National Historic Preservation Act gives them some credence to make sure that we're doing that correctly for them and what's lawful, then we'll see what this judge has to say.
All right, Joel, your last word today on this or any other topic.
I'm going down there. I'm going down there tomorrow. In fact, I'm going down there tonight. As soon as I'm done here, I'm taking off this tie and I'm driving down to the reservation. I'm going to go visit with some of the protesters, and I'm going to do my radio show from down there tomorrow. I've been asked by the tribe, I've been asked by a number of individuals involved with the tribe to come down and make sure their story gets a chance to be heard. So I'm going to reserve some of it till then. What's of great interest to me is why it didn't go north of Bismarck, and one of the arguments Bismarck made was its water supply. So I do believe it's the tribe's fault, and I've said this on air, that they didn't take an active role in the process. Now that being said, I built, in my time at Rural Water, over 2,700 miles of line. And what I found is that you put a notice in the paper, the township officers aren't going to show up. But you call them and say, you know what, we're coming through your township. You got any areas you want me to look out for? You treated them with respect, and now they treat you with respect. And so there's something here that I'm not onto yet, and it's too early for me to comment on it. But I do want to give them access to be able to be heard and talk to you. It's cultural too as well. And I understand. I totally understand. There has to be a way and a method of doing this. And the safest way to move oil is by pipeline.
Yeah.
Bar none, it's by pipeline. I was a supporter of the Keystone Pipeline. So don't look at me as though I'm out there hugging some tree somewhere. I've cut some down in my life. What I'm trying to get at is make sure that people that normally don't have a voice, and there's no way to say this without sounding critical. We as a state government are not good at talking to our tribal brothers and fellow North Dakotans. We aren't. We aren't. And I'm sorry to go back to this issue.
I would disagree.
Did Wayne Stanjum go down and talk to him about the nickname?
Joel, your last
I
word.
mean, he made a deal on a nickname, wouldn't even go to the reservation and talk to him. Talk to him.
Yeah, no,
that's what I'm going to do. I'm going to go talk to him.
I think that's
All
a
right.
good plan.
So, gentlemen, I want to say, first off, thank you for today. Thank you for moderating. Thank you for taking your time. You come at your expense and do this. You've been here time and time again. Thank you for participating in this panel. It was very enjoyable. At times a little bit rowdy, but I think very, very enjoyable. So join me in giving them a round of applause.
Well done. Thank you. Thanks, buddy.
Tom?
Okay, I think we have another survey that we're going to ask you guys to take here. If we can. Do you like the HotBox segment of the Policy Summit? It was new this year. Should we use it in the future? Yes is GNDC 14 and no is GNDC 15. So we'll give you guys some time to punch that in. And again, thank all the panelists today for